I think for us, there's so many categories that have gaps. Like I mentioned, contraceptives. There's also menopause patients. At the same time, there's also other categories like pregnancy, infertility as well. For us, we're in the femtech space because we're trying to address the gap and trying to address the unmet needs of women. In our case, that's in women's healthcare, right? And for us, the online part and offline, one cannot exist without the other. Most of our patients come to us first when they learn about Kindred, and when they're a new patient, they come to us through our virtual clinic. But then, along the way, as we go through their care plan, we're able to convert them to become our offline customer, meaning they go to our physical hub, such as this facility, because we can't do everything online. So most often what happens is step one, they come to us for virtual clinic, virtual consultations. But again, we can't do everything online. You need your ultrasound, you need your pap smear, your annual physical check as well. That's why we have our own hub, our own, the first flagship clinic and the first woman-centric clinic as well. Step two is very important, as in the doctor being able to examine the patient in person, because a lot of our patients suffer from chronic conditions that need special attention, need a lot of screening and diagnostics. So we're able to complete the care cycle and really provide that continuity and care. And continuum is one of the pain points of healthcare professionals as well, is that if the patient doesn't come back to complete their treatment, or doesn't adhere or comply to the treatment because of probably poor patient experience, or there's no continuity, then it's really hard to the outcome is it's poor patient outcomes. And at the core of our business is our patients and our customers, so we always have to make sure that we come up with the best possible patient outcomes. So that's the importance for us, why we're a hybrid business, why we provide hybrid care, is that you can do a lot of things online, but to complete the care, we have to make sure we're able to see our patients as well. And there's a lot more things that we need to do. But what we've learned in our past year is that building a business around a core mission and a purpose that's very close and very personal to us helps with everything else. I think the sales and the profit will follow when you're guided by your why or your North Star. And for us, that's empowering women, making sure we provide a safe space, and educating them to take charge of their health. And then everything else on the business side follows. And for me and my team, I'll speak for my team as well, that we're all here united by that mission, and we need to keep it that way. Everyone that works at Kindred is this is not just a job or a business for them. We're very mission-led in that sense. It was very challenging. I think we're one of the very few companies in the Philippines, especially in the startup world, that is mission-led, but we're also a for-profit business. We're trying to prove that we can do both. We're trying to prove that those two things are not a separate two separate things for us. So we've made a lot of changes along the way and learnings, and we keep iterating on our services and continuously improving them. Some examples would be last year when we started, at the very beginning, we didn't see a lot of mental health patients. And then over time, what we've noticed is, although we've been focusing on reproductive health, we realized that we need to always have a holistic approach. We can't look at the woman in isolated body parts. We need to look at the woman as a whole, as opposed to different systems, right? That's the typical traditional approach in healthcare. Well, we realized, of course, everything is connected. Now we're learning more and having a good level of awareness about mental health. So we've launched psychiatry consultations, psychology consultations. Whenever we push out new services, we don't just turn it on for the sake of, or just because we want it. We do a lot of focus group discussions, customer surveys, so that we know what they need, we validate our assumptions, and we cater to their demands and keeping that quality as we grow and we scale, making sure that we're still providing quality services. So a lot of what we do are guided by our patients as well, in terms of what their demands are, what they need, or even supplementary care. Then we add that category to enable a complete care plan also. So we're not afraid of experimenting, but because healthcare is highly regulated, I'm all for testing, but because we're dealing with people's lives, we're not also a typical startup that can break stuff or disrupt things. But we are innovating. We are somehow disrupting, but I don't like to use that word, honestly. But in healthcare, we have to make sure we're very compliant. We have to make sure that we're doing the right thing for our patients, and we have to make sure we're taking care of our doctors and nurses as well. So it's challenging that way, but we keep learning, and then we keep changing the way we do things if we see that there's a better avenue for that. Making sure that we keep protecting and saving lives, since we're dealing with women's health and lives here. It's not like, because I used to work in e-commerce, and we do a lot of things that are very, we do a lot of A/B testing, experimenting, but in healthcare, it's not as straightforward as selling a product that you can touch, see, and feel before you buy. It's not like you can buy like a pair of sneakers or lipstick right away. For us, we're very intentional about our approach, and that's one of the, I guess, learnings and challenges that we've had in the last year. But it'll only make our services better if we approach it that way. I mean, one of our main challenges is, like, we want to do a lot of things. And I think for us, there's so many categories that have gaps. Like I mentioned, contraceptives. There's also menopause patients. Most of the menopausal and perimenopausal women still don't know that there are actually ways that you can relieve your symptoms and hot flashes. At the same time, there's also other categories like pregnancy, infertility as well. So I think one of our main challenges is, like, how do we make sure we're still serving our patients' needs while keeping that core of the business, which is reproductive health and women's health. But one of the challenges is that how can we make sure that we're winning in those categories all at the same time? So we're also learning based on our patients' feedback again, which is like that's what we're guided by, about what they need. So where the demand is, then we'll fill in that space. But of course, it's hard, unlike in a particular business that has a particular focus. I think that's definitely easier. But in women's health, there's just so many underserved segments of women that we want to solve. But yeah, we try not to bite more than we can chew, so we're taking step by step also. Definitely, I think courage needs to be there. You need to not be afraid to test and try things and actually take the leap. I came from a corporate background and a startup background as well, and it was, comfortable. But I think once you decide that you really want to do something, then you gotta be ready to not just jump into it and be brave enough to start it. I think actually that's one of the most hardest things, is like to actually take that first step. I think it's one of the most hardest things. But once you're there, making sure that you remember your mission and your why and why you're there, because that will make things easier. But also accepting that things are not going to be easy will prepare you for your next steps better. Yeah. Well, I've learned that you gotta have a great team behind Kindred, and it's a blend of healthcare professionals, business professionals from diverse backgrounds. But it's also important that you have common objectives, even if you have different functions and different tasks, that you're all working towards the same objectives guided by your leadership team. So I think that's key. That's very important. What I like about our, I guess, hybrid team is that we're learning from each other. The business team is learning from the care team, from the medical team, and the medical team, it's like a new breed of doctors, and they're very techy also, which is very rare, because they learn from each other, and they're proud of what they're learning, that they don't think they would have learned anywhere else before. And I like the synergies that we're having. It's challenging because it's very different work styles that we're used to, but it doesn't mean that we cannot work together. So I think having a great team behind Kindred is really, really, really important, whether that's doctors, nurses, marketing, operations, compliance. That's what makes up our different departments, and patient experience and customer success also. So you have to make sure it takes a village. But that village needs to be really, really solid, since we're dealing with people's lives.